Dr. Desmond White, gastroenterologist. I want to talk about fecal impaction. It refers to feces stuck at the anus, just at the rectum area, and patient cannot pass motion. I recently have two patients that had the similar problem. One is 80 plus year old, both are 80 plus years old. One came and see me because he had not passed motion for 2 weeks. Another referred to me by a surgeon because the patient has not passed motion for 10 days. What happened is that our large intestine function is to absorb water and salt. So when the motion comes out from the small intestine into the right colon, that is the cecum and the ascending colon area, they're mainly liquid. But when the feces goes through the ascending colon, transverse colon, descending colon, come out in the rectum and the anus, they become solid or pasty or like ice cream-like. So the large intestine will absorb the salt and the water content of the feces to change it from liquid form to a solid or a semi-solid form. Problem comes when the feces are stuck, stay in the colon for a long time, say for a few days. The water content of the feces continue to be absorbed by the colon lining, and the stools get harder and harder and harder. As a result, the left colon, i.e. the rectum and the sigmoid colon, the feces are jammed there, they become very hard. When they're hard, then the feces in the descending colon, transverse colon, and the right side of the colon, they cannot push the feces across because it's stuck. It's almost like a long tube. At the end, it was stuck, so no matter how much the feces go inside there, they're going to come out. And the problem is some patients try and wait, but they didn't work, and they often come very late. As I say, the first patient I saw was 80 plus years old. By the time he came, he has not passed motion for 2 weeks. So what can we do to lower the feces, to remove the feces? First one we normally do is to put a finger, of course with a pair of gloves, through the anus into the rectum, try to take out as much hard stool as possible. It can be very uncomfortable and painful, so I usually do it under sedation when I put the patient to sleep. But my finger is only this long, so I can only take out a little bit of the last part of the motion. We normally add on a suppository, such as a Dalcolette suppository, that will help to liquefy the stools in the last few inches of the rectum, so they will be liquefied and come out. But that's only the last bit of the rectum. We will then add on what we call a fleet enema to strengthen some lubricant. We can often reach the sick part of the sigmoid colon as a lubricant. We can loosen out the stools. But if the fecal impaction is very long staying, say more than 10 days, often not just the rectum, sigmoid, even the descending and maybe even the transverse colon may have hard stools, and they become a management challenge. Some people even resort to doing an open surgery to open the feces, take out all the hard stools, but that's extreme. I have the privilege of not having referred to any surgeon for such a serious treatment. So what I normally do is oral laxative. Oral laxative may not work because when the time it goes through the small intestine, goes to the large intestine, if the whole colon is full of hard stools, the laxative by mouth can only liquefy the one on the right side. The transverse and the descending colon on the left side, they are still not liquefied. So they will help, but doesn't solve the problem completely. So several times I need to do this special method. We call it endoscopic colonic lavage. I basically put in a scope from the anus to the rectum to the sigmoid, and I infuse laxative into the sigmoid. Hopefully I loosen up the stool and more stool can come out. This usually helps, but it requires procedure, requires sedation. To sum up, if you are constipated, don't wait till you have 10 days or 2 weeks to see doctor. Do see the doctor, see your family doctor or GP, take laxative just when you cannot pass motion within a week. Don't wait for 2 weeks, that's too long, and fecal infection can be very hard to manage.